Assalamualaikum warahmatullahi wabarakatuh. Hello everybody, my name is Amanda Dewi Karisma from Stikes Pemkab Jombang. In this video, I will try to explain the lymphatic nodes examination. For the first, I will review about the lymphatic system to make our easier to understand the lymphatic nodes examination. Lymphatic system is a network of tubes throughout the body that drain fluid from tissues and empties it back into the bloodstream. The main roles of the lymphatic system include managing the fluid level in the body, filtering out bacteria, and housing people of white blood cells. Lymph is filtered through the spleen, thymus, and lymph node before being emptied into the blood. Lymphatic system keeping a balance of fluid. Blood vessels tend to shift fluid into surrounding tissue. The lymphatic system drains off any extra fluid to stop the tissue from puffing up. The feet, in particular, are prone to puffiness. Lymphatic vessels crisscross their entire body, except for the central nervous system. Some lymphatic vessels have valves which stop the lymph from running back the wrong way. The spleen is inside the abdomen, just under the diaphragm. This is one of the filtering organs of the blood, as well as removing microbes. The spleen also destroys all or damaged red blood cells. The thymus is inside the ribcage, just behind the breastbone. This is another filtering organ of the blood that contains many white blood cells called lymphocytes. Lymphatic nodes are found at various points around the body, include the throat, armpits, chest, abdomen, and groin. Allied close the arteries. Bacteria pick up from the tissues by the lymph are trapped in the lymph node. White blood cells called lymphocytes can then attack and kill the bacteria. This is why your lymph node tend to swell if you have an infection. Virus and cancer cells are also trapped by lymph nodes. The major lymph node groups are located along the anterior and posterior aspect of the neck and on the underside of jaw. If the nodes are quite big, you may be able to see them bulging under the skin, particularly if the enlargement is asymmetric. It will be more obvious if one side is larger than the other. To palpate, use the pad of all four fingertips as these are the most sensitive part of your hand. Examine both sides of the head simultaneously, walking your finger down the area in question while applying steady, gentle pressure. The major group of lymph nodes, as well as the structure they drain, are listed below. The description of drainage pathway are rough approximation, as there is frequently a fair amount of variable and overlap. Position number 1: anterior cervical. Nodes that lie both on top and beneath the sternocleidomastoid muscle (SCM) on either side of the neck, from the angle of the jaw to the top of the clavicle. This muscle allows the head to turn to the right and left. The right SCM turns the head to the left and vice versa. They can be easily identified by asking the patient to turn their head into your hand while you provide resistance. Drainage, the internal structure of the throat, as well as part of the posterior pharynx, tonsil, and thyroid gland. Number 2. Posterior cervical. Extend in a line posterior to SCM but in front of the trapezius, from the level of the mastoid bone to the clavicle. Drainage, the skin on the back of the head, also frequently enlarged during upper respiratory infection. Number 3. Tonsillar, located just below the angle of the mandible. Drainage, the tonsillar and posterior pharyngeal region. Number 4, submandibular. Along the underside of the jaw and either side, drainage, the structure in the floor of the mouth. Number 5, submental. Just below the chin, drainage, the teeth and intraoral oral cavity. Number 6, supraclavicular. In the hollow above the clavicle, just lateral to where it joins the sternum, drainage, part of the thoracic cavity, abdomen. Lymph node exam. Palpation of the lymph nodes provide information about the possible presence of a malignant or inflammatory process and the localization or generalization of the process. Size. Insignificant if less than 2 cm. In axilla and inguinal, significant if less than 3 cm. In the clavicular fossa, more than 1 cm is significant. Constituency. Soft, insignificant, rubbery, classically lymphoma, hard, classically maligna, and granulomatous infection. Tender, classically infection versus non-tender, classically malignant. Patient 2 until 12 years old, commonly present with insignificant lymph node in neck secondary to frequent viral infection. Technique to examine the lymph nodes. Number 1. Examine for any evidence of lymphadenopathy in the head or neck. Be sure to examine the back of the head in the area of the occipital nodes. Number 2. Always evaluate for symmetry. Clinically significant node classically asymmetric. In here, tonsillar, and here submandibular. In here, anterior cervical, and here posterior cervical, and this here supraclavicular. Number 3, identify salivary gland by location as non-lymph nodes. Number 4, identify carotid artery or bulb by pulsation as not lymph nodes. Number 4, supraclavicular fossa, most significant area, often indicate a process deep in body. Left supraclavicular nodes, classical site of abdominal process. Right supraclavicular nodes, classic site of intrathoracic process. Number 6, trim fingernails. Number 7, infraclavicular fossa nodes, classically breast cancer or malignant lymphoma. And number 8, epitrochlear lymph nodes, best felt when moving finger up and down. When a lymph node is found, it is important to comment on the following characters: location, size, shape, mobility, tenderness, and texture. Okay everybody, that's all about the lymphatic node assessment. I hope this video can be useful for you. Thank you for watching and wassalamualaikum warahmatullahi wabarakatuh.